When someone is first infected with either HIV or hepatitis B, they may experience what's called an acute phase of infection. For HIV, this often occurs about 2 to 4 weeks after exposure and can feel a lot like a bad case of the flu: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes. Similarly, the acute phase of a hepatitis B infection can also present with non-specific symptoms. Many people, especially young children, may have no symptoms at all. If symptoms do appear, usually 1 to 4 months after exposure, they include extreme fatigue, fever, nausea, vomiting, abdominal pain, dark-colored urine, clay-colored stools, and jaundice. After the acute phase, both viruses can enter a long-term or chronic stage. For HIV, this is often called the clinical latency or asymptomatic stage. During this period, which can last for a decade or more without treatment, the virus continues to replicate at low levels, but the person may feel perfectly healthy and have no symptoms at all. This is a dangerously deceptive phase. Even without symptoms, the virus is still active, slowly chipping away at the immune system, and the person can still transmit HIV to others. The chronic stage of hepatitis B can also be asymptomatic for many years, which is why it's often called a silent epidemic. Because the early symptoms of both HIV and hepatitis B can be so mild or even non-existent, you just can't rely on how you feel to know your status. The only way to be certain is through testing, which is typically done with a simple blood test. For HIV, the standard screening test looks for antibodies. Those are proteins your immune system produces to fight the virus, as well as antigens, which are parts of the virus itself. The combination antigen and antibody test can detect a recent infection earlier than antibody-only tests. Diagnosing hepatitis B also involves a panel of blood tests. The hepatitis B surface antigen, or HBsAg, a positive test means the person is currently infected and can spread it to others. The hepatitis B surface antibody, known as HBsAb, indicates protection from past infection or successful vaccination. The hepatitis B core antibody, called HBsCAb, helps determine if the infection is recent, acute, or long-term, meaning chronic. Together, these tests give a complete picture of a person's hepatitis B status.